Hello, my lovelies, and welcome to Where the Road Rises with me, your host, Eileen Curlin-Walsh. It is a delight to be back. I have missed my friends here at Peerless Heights TV Channel 4 and you, my dear viewers. I hope you are safe and well as we navigate the strange year that has been 2020. We are now 7 months in, 5 to go, so please God, the remainder will be a bit more gentle with us. And speaking of difficult navigation, today on the show we're going to tackle health insurance and Medicare with industry expert Anna Minkina. Anna is a healthcare benefits consultant. She is partner and district manager with Healthcare Solutions team. She works with small business, with groups, with Medicare recipients, families, and individuals to meet their total healthcare needs. She writes a newspaper column, appears on TV and radio segments, and speaks widely on Medicare and the ever-changing landscape in healthcare. We are honored she will share her wisdom with us today. Welcome, Anna.
Thank you. It's a pleasure.
We shouldn't be shaking hands, but all habits die hard. Anna, why don't you start by telling us your story and how you found yourself immersed in the world of healthcare and Medicare?
I started off in a completely different industry. It was back in 2010 when the industry that I was in, which was promotional printing, completely changed.
Oh.
So I found myself looking for a new opportunity, and I had newly gotten divorced, so I was the single mom of 2 children and wanted to look at something that had flexibility but could afford me the income and have some time to spend with my children and work that way. So I got a call from this company, Healthcare Solutions team, and they asked me to come in and they spoke to me about health insurance, and I had never thought about health insurance before. But the opportunity was great enough that I could manage my flexibility, spend time with my children, and have the income based on my own work and that. So I was self-employed and I was representing all the major companies. And it was a really good thing for me at that time as well because healthcare was changing. I was taking care of my parents at the same time. They were elderly. So, or my mom, in fact, and so it was a really good opportunity for me to be able to have that flexibility.
Brave new world.
Yes.
And you found you loved it.
I do.
And Anna, I'm sure taking care of your mom too, as well as young children, you were seeing every strata of care, as well as yourself.
Yes.
And the need at every level. Let's get started as we talk about healthcare with where we're at right now. It's just the elephant in the room, the pandemic. How has that affected healthcare options, costs, testing? What's been your experience with your field since February?
It's been a big change because I work, as you know, with small groups, individuals and Medicare, and the small groups and even the larger ones have been affected tremendously because you've had layoffs in there or permanently termination because they just can't stay in business. So the options for them are interesting because usually it would be COBRA, but because of income they don't know when they're going back. If anybody's hiring in that, they can't afford COBRA. So then the other option is going to like the marketplace where everybody goes on there and they get a subsidy to pay for their premiums based on their income. And again, there's another option too because some people don't know, you know, how much income they're going to have, and then it's a choice. Do I pay my mortgage or do I pay my health insurance? So then there's some people that I've recommended to go on to Medicaid, and I know they don't like the idea, but it's a, you know, it's a temporary thing. You know, just think of it as you're covered. Anything catastrophic comes into place, and if things change, you can change from there. But you need to be covered, especially in the pandemic. And that.
Well, let me ask you this, Anna. We're sort of conditioned to believe we can make choices at one time a year. And that's not February. Typically, it's November, December. So is it possible to enter the marketplace? Is it possible to apply for subsidized health insurance in February and March and April, the time that we find ourselves in this great need?
Yes. What it becomes is, it's called special enrollment period.
Okay.
And they have to do that within 60 days of an event. So say you got let go like in March, So, and your insurance runs out at the end of March, you'd only have 2 months, so you'd have April and May to do something.
Okay.
Not to say that there aren't other options, but the options become more limited if you don't do it within that 60-day window.
Okay.
Because there's short-term plans too, which run in Illinois. We can only run for 6 months, which are good, but there's a little caveat on the short-term plans, because as the regular insurance plans don't go through underwriting and no medical questions, the short-term plans don't cover anything from the last 5 years. So if someone has a condition, like I'll have somebody say, I'm fine, I don't have any condition, but then again, I take high blood pressure, I take cholesterol medicine, or I have mental health issues and stuff. So each person is different as far as their options in that, and it's definitely like a puzzle for me when I work with these individuals.
Boy, you could see where your experience really matters. Now, if someone did find themselves infected with the virus and now they're having to go through ER, maybe having to be placed in a ventilator, is their treatment just exactly what typically is covered by insurance, or was there anything offered specifically to help those who had been infected with the virus, needed a lot of help with their health care? And was it anything unusual? Was there anything provided in the stimulus package for that?
Not in the stimulus package, but each insurance company will cover the COVID, except for the prescriptions. But it has to be a confirmed diagnosis of COVID, and then they will cover it.
So each health insurance, regardless of what plan you picked,
correct,
would have covered it.
Correct.
And was that part of an emergency order?
Yes.
Wonderful, wonderful.
Yes.
There really were some terrific programs that did go into place that helped as much as possible for this unprecedented situation. So let's talk about the different kinds of plans. You often hear of the medals, right? The gold,
yes,
silver, bronze. Just in a very general sense, could you describe typically what those differences are?
It sounds like diamond rings to me.
Yeah, precious metals.
Precious metal. So it's bronze, silver, gold, and platinum.
Okay.
So bronze is the highest deductible but lowest monthly premium. Silver, the deductible goes down a little bit, but the premium goes up. And then gold and platinum, the same thing. As the deductible goes down, your monthly premium goes up. Most people are either the bronze or silver level, because gold and platinum would be someone, I say that maybe they have some kind of a condition or surgeries that they have to have, and so they'll hit the deductible a lot quicker.
Right. So what about the HMO and the PPO? Where do they fall into the equation?
So that's a really good question, because everyone is so confused about it. And so an HMO is, you'd have to have a primary doctor. Primary doctor refers you to other doctors, so you have to stay within the network. PPO is, you don't have to have the referrals, but you still have to have people within the network on that. Right. So, and the question being, so in Illinois, we have a really different puzzle, because this year especially, you have the major carrier for individual plans, but not all doctors and all hospitals accept the same network plans. So before, for instance, Blue Cross is a wonderful company, and everybody who grew up with it just thought that if you go into a doctor's office and you show them Blue Cross, they accept it. Well, it's different now. It depends on what network you're in. So one doctor might accept the HMO, one might accept more of a limited PPO.
Right. So with the HMO and the PPO,
sure,
it does. So I keep coming back to the deductibles and the percentages. Is a PPO more likely for you to owe a percentage rather than the HMO, or is it just all down to whichever plan you choose?
It's planned, because I know it's very confusing. Deductibles, co-insurance, maximum out-of-pocket for both for the HMOs and the PPO. The deductible amount, let's say it's $1,500. So that's what you're responsible for before. It's got to be eligible health care benefits and that for services. So you're responsible for that $1,500 before, if that's your deductible, before the insurance company pays their portion. And so, and not to think that it's like $1,500 off the top, it's discounted because you have insurance. So let's say normally you'd go to the doctor and you have some service done, and without insurance it would have been $3,000. But because they have an agreement with that insurance carrier, maybe it's down to $1,200. So you don't have to pay that deductible all at once. As you get services done, it goes to that. Once you hit that deductible, then depending on what plan you're on, whether it's 60/40, 70/30, 80/20, 90/10, which is confusing, and then that'll be your portion until you hit, it's called the maximum out of pocket.
Okay.
So let's say your maximum out of pocket is $7,000. So the maximum you'll pay for that one person is $7,000, and then the insurance company picks up the rest.
Right. So there is the comforting knowing that no matter what, for myself or my family, I'm never going to pay any more than this dollar amount in a year, no matter how catastrophic the health care needs are.
Absolutely, and they have individual out-of-pocket and family out-of-pocket. So that's what they have the deductibles, and you have to have, depending on what insurance plan, either 2 people or 3 people have to meet that amount, and they have a cap on it. So it's confusing for everyone.
Yeah, and we're quick to ask you, what should I do? Should I pick a percentage? Should I pick a higher deductible and a lower out-of-pocket? But ultimately, you really can't decide for us, right? We have to decide ourselves. You just give us the options.
Well, that's why I'd like to sit down with each person, because each person's healthcare needs are different, as I mentioned before. So maybe someone has a family member that has something severe. Maybe they have heart conditions, so they have diabetes or asthma or something, and they're going to need more care. But at the end of the day, even though they need more care, it has to be affordable. So I usually weigh, here's the deductible, here's the affordability, what can you afford? This might be a better plan, but if you can't afford it, then it doesn't make sense for them.
Absolutely, absolutely. Now, we were talking about the pandemic. Were there supplemental plans, or is that what you just told me about the 6 months? Is that what was made available to kind of counteract the devastating effect of the pandemic on the wealth, on the income of some families?
There is. The 6 month is a short-term plan, but what the supplemental plans, they've been in place for a while, but I think the pandemic brought to light that people really do need some other sources of income, because if they get sick and they're in the hospital and that, they're not going to pay for income. So there are, depending on if they work for a company, there's short-term disability plans. There are hospital expenses plan, which works, that gives you money every day that you're in the hospital. There is a company, it's kind of like an AFLEC plan. AFLEC is really good. AFLEC is a great plan, but there are also, for individuals, there are plans if you're not part of a company. So there are options, hospital, accident plans, like I said, short-term disability, telehealth. Really, really important these days too.
Yes. So it really, just like us and our Zoom for all our business meetings, the telehealth has been having a moment.
It has.
Tell us a little bit about that, and do you think it's here to stay?
I definitely think it's here to stay, because people don't want to go in for minor things, especially with the pandemic. They don't want to go to the doctor's office, traveling there, and so it's really a good thing. Because, go ahead, I'm sorry.
Excuse me. Maybe explain to our viewers what telehealth is.
Telehealth is where you dial in to a certain number, and you could do it versus Skype, or you could use it on your phone, and you talk to a doctor, and they can go over the instances. In some instances, they'll open your mouth. So maybe they can be able to treat something minor. Now, if you have something where you have to go to the emergency room, like a heart condition, or if you cut your hand, you need to go in stitches, that's a different one. But it's sometimes in the middle of the night too, you have children, they're running a fever and that, and so maybe they can help you at that time, because they can call in prescriptions to the pharmacy as well.
And what I have discovered from talking to clients via video conference during the pandemic is that you can reach a level of closeness and intimacy that you cannot over a teleconference.
Correct.
Certainly it's not the same as meeting in person. but you really can get to a level of comfort to talk about intimate or difficult things
Sure.
via the video conference. And I think all of us, whether we are digital dinosaurs or natives, have been able to find a way to get on board. When I was speaking with my clients during the pandemic, we had an emergency order where we could sign via video conference. There was usually a child or a grandchild or a very savvy 80-year-old with his own cell phone and knew how to
Yes.
zoom up with the best of them. So I do think, along with the tragedies of the pandemic, there are going to be some advances that we were forced into that will stay with us and may help us all.
Oh, I think there are. There are a lot of advances, especially for the elderly too.
Yes.
That's a big thing too. Before we had to do meetings in person, and now with the pandemic we really can't. And so they're learning different ways of communicating with us, and we are too. So that's a great thing.
Wow. We're always learning. And speaking of our seniors, let's talk about Medicare. You and I, Anna, both speak with seniors. We
Yes.
speak together to seniors about estate planning and about Medicare. So why don't you give us a little 101 again on Medicare, aging into Medicare, retiring, and just some basics for our audience.
That's interesting you said too about the retiring, because a lot of people before the pandemic thought, I'm going to work many more years. And now with the pandemic, I have more and more people calling me like, I think I'm going to just retire now. You know, I've hit the age, so I'm going to retire now. And the biggest thing is, it's a whole new world, as you know, in Medicare. So Medicare is 65 or older, or if you have some kind of a disability, renal stage disease and renal stage, Lou Gehrig's. So there's a number of them that get disabilities, so they qualify for Medicare under 65.
Right.
And the biggest issue is that they just don't know where to go to get information. You know, they'll say to me, you know, I called this company, this company, this company, and they get inundated with information too. When you turn 65, everyone is mailing you information, and so I have a lot of people saying to me, I just want the best, I want the best. Well, when you get into the Medicare world, it's completely different. You know, you have to have, so Medicare, it has two parts to it. It's Part A and Part B. A is hospital, B is your office visits and some other things. And they only pay 80% of your costs. So you need to supplement that either with a Medicare supplement or Advantage plan, and you need drug coverage. And people don't understand everything, because if they don't do it during their eligibility period, then sometimes they have penalties and fines, so that they would have to have that for the rest of their life as far as, you know, drug coverage or Part B. But there's so many avenues to it, like if they're still working or something like that, and they have no one to really turn to, especially the elderly who are not very good on the computer, or even aging in. I have friends and relatives who have aged in, and they're like, how do you know this? It's because that's something that I work on daily and weekly, getting updates. And to me, I really, really enjoy being able to work with them, because they're so afraid in some instances, and to trust someone. That's the biggest thing.
Yeah. And just as we were talking about the precious metals sound like a jewelry box, you have this alphabet of A and B and D. So you had said that the Medicare is Part A and Part B, and then the D is the drug
plan, correct, prescription drug plan.
And then what are the other numbers? Are the supplemental plans also get their
letters?
Letter?
Yes, they do.
They earn their letters?
They earn the letters of the alphabet. There's F, and there's G, there's L, and there's N. And again, it depends on each person's needs and that, which plan they should go to. There's also, they're called Medicare Advantage plans, which are really good too. But again, it's got to be each person individually, their needs. You know, we have to look at their doctors, what medications they take, what their really true needs are as far as deciding which plan, but they just don't realize that. I have a lot of individuals, even clients of mine, call during open enrollment, and they said, oh, why don't I have that? I have this for free. They said I can get this for free and this for free. And you know, I think they're thinking of all these things I can get free, but they just don't understand that that plan might not be good for their needs.
Okay. Yeah. So that's really where you come in. And full disclosure, viewers, Anna found a wonderful group plan for my office that saved us thousands in prescription drug costs alone. So I'm a big fan.
Thank you.
And I know many of your clients are. So tell me what your approach is to finding the right plan for a family or an office or a group, an individual. You know, what's your MO?
Thank you. I like to sit down and find out what they really need. Again, like I said, I like to sit down, you know, what the healthcare needs are of the family or the business, you know. I think businesses in particular, like yourself, people don't realize that you can start a group plan with as little as 2 people. It just can't be husband and wife. But it could be 2 people. You could start a group plan, and the prices this year were about 1/3 less than individual. And then you have access to the nationwide PPOs, which aren't available to individuals this year. Hopefully it'll change for next year, but those aren't available. Some of the plans aren't available.
Yeah, which for small businesses is a lifesaver, because when you don't have 50 employees, you really want some options and you want it to be affordable. So it's wonderful that small businesses now can get on board with group plans and have some of the advantages.
And the other thing is too, is with the small businesses, they are looking like everyone else to be able to attract employees. And with the pandemic and everything else, they're looking for benefits. And what a nice way to be able to offer them, which doesn't affect the employer very much, because it'd be part of their benefit package and that. But they are always looking now, because of the pandemic, how can you help me with benefits like health insurance?
Absolutely, Anna, and I am hiring a paralegal at the moment, and it is so lovely for my office to be able to offer health care. So thank you for that. It's clear that you love what you do, Anna, and it's clear that you care about your clients, your customers. What do you love most about what you do?
I really love helping people and seeing how I can help them with different instances. I'll give you a couple different instances. One was a woman, and I won't forget, her husband had suddenly passed away, and they had health insurance, and then she was looking at taking on 3 jobs to be able to afford her health insurance. And I brought her in, and we sat down and we looked at her income and that, and was able to get her onto a marketplace plan with a subsidy. And so all she had to do, she's working 1 job and she can afford it. And she said, "You changed my life forever, because I thought I was going to have to work 3 jobs to be able to afford it." So that, helping others really, and seeing, like I said, what my mom went through and my dad when we were younger, just seeing what they went through, it really makes me happy to be able to see that people like yourself and families. And I also work with divorces, because they're going through a divorce, and usually one of the spouses doesn't really understand about insurance, and I have to pay for it. So counseling them about what to expect is really important to me.
Yeah.
That, and like I said, we do the Medicare. People don't know what to expect, and I love to educate them on what to expect, what to look forward to, how do you budget, you know, what things to keep in mind.
And Anna, your point about divorce is really salient, because often one of the couple carries the health insurance for the family, and now one of that couple, and maybe even, well, possibly the children, are now going to have to look for something different. So, boy, there's just unintended consequences with everything. So ultimately you get that peace of mind. You're always giving people peace of mind.
I do.
And what has dealing with people on a very vulnerable level, because many times when people are looking for health insurance, they are maybe sick, they're frightened, they're fearful of the costs, they're confused by, you know, this rows and columns of different plans. So what has that taught you about people, or maybe even yourself, these last 10 years of your life, more 12 now, where you have been immersed in people's intimate lives? I mean, there's nothing probably more important to us than our health.
That's absolutely correct. That's our biggest asset, I tell everyone, is your health. If you don't have your health, then you don't have anything else. And the thing I think it's taught me is each person is individual, and I'd love to treat them like I would treat my parents or, you know, family, because it's so very important to me. I've run across instances where there are people that are not thinking about what that person needs. They're thinking about more of themselves, what they want to unfortunately sell that person.
Yeah.
And each person is so different, and like I said, I like to treat them like their family and understand them. I found during the pandemic, which is really interesting, it just almost made me more calm, because it was like I spoke to a couple people and I'm like, take a deep breath, it's going to be okay, we'll make it through this together. And so helping people know that they have someone in their corner that they can trust, that, you know, can give them some different options. Like I said, I won't tell them what to do, I'll just say these are your best options and here's the pros and cons of each one of them.
How wonderful to have the skills, to have spent all these years honing the skills and knowing the choices for people when they find themselves in great need. It's just so deeply satisfying. Anna, Anna is wonderful hands to be in for your healthcare. So if any of you have a need, and maybe also some of our viewers would want you to come and speak to their group about Medicare and healthcare. So let our viewers know how they could get a hold of you.
Thank you. Oh, I love speaking to groups. And right now, as you mentioned, we're doing a lot of Zoom meetings, and we can do that. I do it with businesses too, where we're doing a group luncheon meeting, and so I'm up on the TV in the lunchroom, so, and individuals too. I have so many people calling me about their relatives and that, so they can reach me at 708-426-3680. That's my cell, so you can text me on that, or you can reach me at annamhealthcare@gmail.com, and I'm always happy to help. You know, even if you have questions about something, I'll take the time out to work with you and help you with any questions you might have.
And she answers her phone after 9 at night and before 9 in the morning. Maybe I shouldn't tell you that. Well, thank you so much, Anna, for sharing your knowledge, and thank you, viewers, for watching. It's wonderful to be back. And as I mentioned at my last show, I am now your neighbor over at 117th and Southwest Highway in Palos Heights. So come see me. And if you have any questions or ideas or suggestions for future shows, you can always reach me at 708-448-5169. So thanks for watching, and I will see you next time on Where the Road Rises.
Thank you, Eileen. Questions about something?
Before
with any questions you might have.